Hello, my name is Miranda Cox, and in this presentation, I'll be talking to you about the grief that someone experiences as their loved one's health declines after a cancer diagnosis. The quote that actually inspired this topic was, "When you are diagnosed with cancer, everyone around you is diagnosed as well." And this is actually said in the video from Martina McBride's song titled "I'm Gonna Love You Through It." And as you can see in the picture on the screen, this is actually kind of true, as a bunch of people gather around their friend who was diagnosed with cancer and is currently in the hospital. A cancer diagnosis also affects family members and friends. It doesn't just affect the one that's actually diagnosed. When people think of grief and mourning, particularly in instances of cancer or other terminal illnesses, the first thing that actually pops into their mind is death. But the grief and mourning is actually seen throughout the process as their health declines due to the cancer, and this can actually be seen in the loved ones, as well as the person that's actually diagnosed. A lot of times, loved ones experience anticipatory grief along with the person that's being diagnosed, as they anticipate changes in health and identity of the person diagnosed, and changes in their role in the person's life. Anticipatory grief is described as a range of intensified emotional responses that may include separation anxiety, existential aloneness, denial, sadness, disappointment, anger, resentment, guilt, exhaustion, and desperation. Watching a loved one's health decline due to cancer can be devastating. It can overwhelm a person, and its effects are immobilizing. After a cancer diagnosis, you can start to mourn what you thought life would be like if your loved one hadn't gotten sick. Sometimes the private lives, routines, and rituals are interrupted when a loved one requires hospitalization, aggressive treatment, or palliative care, particularly for caregivers. And those changes can be difficult for a person to accept. When a loved one is diagnosed with cancer, there are a lot of things that change, and you may actually mourn these changes. This can be changes in role as you go from spouse or friend to caregiver, and accepting a more involved role can become challenging. Along with that, your responsibilities may change, and you may actually mourn the changes in responsibilities. These added responsibilities can become overwhelming and lead to feelings of frustration and resentment. Changes in both physical and emotional needs may occur in the person diagnosed, and it may be hard to see them need more assistance as their health declines. The changes in plans for the future might be difficult to adjust to also, and you may mourn what you thought life would be like. Things that seemed important before the cancer diagnosis may give way to new priorities, such as spending more time together. But it is important to be open with all of those involved with the person with the diagnosis, just to make sure that everyone is okay. Some things that caregivers or friends may have difficulty with that may actually be signs that they are grieving when a loved one is diagnosed with cancer are dealing with the initial shock of the diagnosis and being in disbelief that they're actually diagnosed. You may also struggle to remain connected to the person, and caregivers may not know how to care for the person in need. It can also be difficult to maintain the structure of the relationship that you had prior to the diagnosis. And it may be hard, but it's also important to figure out how to respect the person and preserve their dignity while caring for them as their needs and dependency level changes. When someone is first diagnosed with cancer, they, along with their loved ones, will seek help from many different professionals, and it is important to understand how you can best serve them. One way to serve them that you can help is to enable and assist loved ones in being available to the person, and reconnecting them with simple activities that will bring them pleasure and comfort. You may also work with the families and caregivers to maintain the integrity of their family life or relationship that they had prior to the diagnosis, and to create routines that can feel normal or parallel to old routines. This can actually make this intolerable time more tolerable. Sometimes people affected by cancer may seek counseling or support groups in order to help them cope with their feelings as their loved one's health declines due to cancer. As a counselor, it is important to encourage your clients to gather information on their illness, which in this case is cancer. Address the practical steps they need to take. Offer productive activities that will help keep them busy and keep their minds off their diagnosis. Connect clients and families with resources they need to help them. And again, throughout all of this, it is most important to respect the wishes of the person that's actually diagnosed. So, in conclusion, it's important to remember that the person that is diagnosed is still the same person they were before cancer. It's important to keep things as normal as you possibly can. You also need to talk about the issues that you're having due to the diagnosis and seek professional help when you feel that it is needed. These are the steps that can help you deal with the grief that comes along with your with your loved one's diagnosis of cancer as their health begins to decline.